What is the difference between ultrasound and MRI for testicular cancer? When it comes to diagnosing testicular cancer, two important imaging techniques are ultrasound and magnetic resonance imaging. Each has its own strengths and uses, which can be crucial for early detection and accurate diagnosis. Let's explore how these two methods differ in their roles and capabilities. Ultrasound is the first-line imaging tool for suspected testicular cancer. It uses high-frequency sound waves to create images of the testicles. This method is highly sensitive and specific, with a detection rate of over 90% for testicular malignancies. Ultrasound can easily distinguish between masses that are inside the testicle and those that are outside. It also helps differentiate solid tumors from cystic lesions and can assess both testicles for any signs of bilateral tumors. One of the best things about ultrasound is that it is widely available, non-invasive, cost-effective, and does not expose patients to radiation. Typically, testicular cancers appear as darker masses on ultrasound images. For example, seminomas usually look homogeneous, while non-seminomatous tumors may appear more complex with possible calcifications or cystic areas. Ultrasound is particularly useful for detecting small or hidden lesions and is the standard initial imaging tool before any surgical intervention. On the other hand, magnetic resonance imaging, or MRI, uses magnetic fields and radio waves to produce detailed images of the testicular tissue. While MRI is not the first choice for diagnosing testicular cancer, it serves as a valuable adjunct when ultrasound results are unclear or when more information about the mass is needed. MRI provides excellent soft tissue contrast, allowing for better characterization of lesions. It can help differentiate between benign and malignant masses and assess the local extent of the tumor, which is especially important if testis-sparing surgery is being considered. MRI has a very high sensitivity, close to 100%, and good specificity, around 87.5%, when distinguishing between benign and malignant intratesticular lesions. It can also identify features like testicular fibrosis or bleeding that might be challenging to see on ultrasound. However, MRI is generally more expensive and less accessible, and it is not typically used for initial screening or distant staging. In summary, ultrasound is the go-to imaging test for suspected testicular cancer due to its high sensitivity and accessibility. It effectively guides the initial diagnosis. MRI, while not the first choice, is reserved for cases where ultrasound findings are unclear or when detailed tissue characterization is necessary. Both imaging techniques complement each other in the diagnostic process, with ultrasound leading the way and MRI providing additional detail when needed. It is important to remember that neither method replaces the need for clinical examination, tumor marker testing, or further imaging for staging. Always consult with a healthcare professional for personalized medical advice.